Hey y'all, if we're just now meeting for the very first time, hello, my name is Stacy. I am an EMS instructor, and I do like to go over different medications that we utilize out in the EMS field. Some of them are not so common, but today's medication is one that pretty much everybody in the general public has heard of, and it's called Acetaminophen, also known as Tylenol. So first things first, what drug class is Tylenol a part of? Well, it is an analgesic, which means that it's a pain reliever. It is a mild analgesic, and it is also an antipyretic, aka a fever reducer. And why do we give it? Well, it actually says right here on this bottle, pain and fever are two indications for administering Tylenol. So what's the mechanism of action, or how does it work in the body? So Tylenol is speculated to act on the central nervous system and slow or block prostaglandin synthesis. What the heck does that mean? Prostaglandins are these hormone-like substances that are a part of a chemical reaction that happen at the site of an injury or some type of other issue. So often they're associated with redness, fever, pain, swelling, that sort of thing. So by blocking or slowing the release of this pesky little hormone-like substance, the patient may end up having a lessened sensation of pain and a reduced fever. As always, before we get into dosages, make sure you're abiding by your local protocol and staying within your scope of practice. But a dose of Tylenol can range between 10 to 15 milligrams per kilogram. The main contraindication of Tylenol that you're going to see is severe hepatic impairment or failure. So similarly to how ibuprofen has an effect on the kidneys, Tylenol has a heavy effect on the liver, and so we have to be very careful with patients that are experiencing liver failure or liver impairment. So when we're talking about interactions, I want to make sure that everyone knows that so many of our over-the-counter medications contain acetaminophen, even if it's a small dose. Our Dayquil, our NyQuil, our allergy medications, cold and sinus, cold and flu, all these medications, a lot of them, I guess I should say, contain acetaminophen even at a small dose. So it could be easy to overdose or cause acute hepatotoxicity if we take too much of it. And Tylenol is one of the most common overdoses out there. Another interaction to keep in mind that isn't necessarily a medication interaction, but if our patient has been drinking alcohol excessively, it would be wise to not administer acetaminophen to these patients because there is already an increased chance of hepatotoxicity with the excess alcohol consumption. And one last side note about this medication is that if a patient accidentally or intentionally ODs on it, oftentimes the hospital is going to use the antidote for it, and it's called acetylcysteine.